Thank you, Chair Sanders, and to the rest of you. This committee has jurisdiction to tackle a broad range of issues facing American families. And we're not always going to agree on the course, but we have the opportunity to have a good faith debate and meet where we do agree. And there's a long history of bipartisanship. Thank you, former Chair Murray, for us to live up to. First and foremost, we need to return to good governance. There is an extensive list of authorizations set to expire this Congress. It's important we fulfill our responsibility to get these reauthorizations done and done on time. The committee has also let authorizations lapse for a laundry list of bills that continue to be funded through the appropriations process. The money goes out the door, but we aren't checking to see if the programs are working well or could be refined or improved to better serve Americans. Chair Sanders and I have had a couple interesting conversations. One thing he said is he likes to spend money, but he doesn't want to waste it. If that is the ethic of this committee, we will be doing our job for the American people. For example, the Higher Education Act has not been reauthorized since 2014. The Workforce Innovation and Opportunity Act lapsed in 2020. Now, previous leaders of this committee hit snags trying to get this finished. I don't suggest it's easy, but we should do our jobs and work to get current on our authorizations. Child care and financing of student loans, two issues sure to come before the committee. I just heard that. Both are far too expensive for the families that have needed them and have only gotten more expensive as federal funding has been made more available. There is going to be bipartisan interest. If we choose to take it on, we must end the cycle of throwing money at problems and work to address the root causes that make education and child care so expensive. One example, President Biden's student loan cancellation policy, now before the Supreme Court, is estimated to cost taxpayers $400 billion. Now, this is on top of the student loan repayment pause, extended 6 times under the Biden administration, so far costing taxpayers $195 billion. This has brought forward our debt ceiling crisis, this continued pause long after the public health emergency has effectively ended. So just last month, the administration filed a proposed rule on income-driven repayment that would eliminate the expectation for student loan borrowers to pay back even the principal on their loans, fundamentally breaking our higher education financing system. The administration estimates the plan will cost taxpayers only, or I should say at least, $138 billion over the next 10 years, but the Penn-Wharton budget model out of Senator Casey's home state and other nonpartisan experts have estimated that this plan could cost anywhere from almost 3 times that amount, upwards to $1 trillion. Now, make no mistake, these loan cancellation schemes do not forgive student loan. It transfers this $1 trillion in debt over the next 10 years from those who willingly took it on to taxpayers who chose not to go to college or worked hard and made sacrifices to pay off their loans. This is not only fiscally irresponsible, it is deeply unfair to the Americans whose debts look different from this group favored by the Biden administration. Where is the forgiveness for the guy who didn't go to college but is working to pay off the loan on his truck he takes to work? What about the woman who was responsible and prioritized paying off her student loans? Is this administration going to give her $10,000 for her mortgage? Probably not. If President Biden's goal is to solve the problem that college costs too much, I would point out that this massive government spending does nothing to address the reasons that college is so expensive. According to U.S. News and World Report, tuition and fees at private national universities has jumped 134%. Out-of-state tuition and fees at public national universities has risen 141%. And in-state tuition and fees at public national universities has grown the most, increasing 175%. The more federal aid Congress makes available, the higher these secondary institutions have increased their tuition. The administration hurling hundreds of billions of dollars at the problem is not going to solve it. There's evidence it only incentivizes schools to increase their tuition even more. We owe it to the American people to provide oversight, not rubber stamps, to the actions of the administration. An example, I was proud to join my colleague and a member of this committee, Senator Braun from Indiana, as he introduced a Congressional Review Act to overturn the Biden administration's environmental, social, and corporate governance fiduciary rule that would authorize asset managers to prioritize funding political causes over the success of their clients' retirement savings. There's just an article in Bloomberg that calls this greenwashing and that shows that this yields a lower return for the retiree and does nothing to decrease emissions. That is wrong. We're talking about the workers' money that they own and worked hard for. This committee should stand with those workers who are counting on a fiduciary to secure the best return as possible for them to have a financially secure retirement. This is exactly the opposite. The way it's currently being implemented is exactly the opposite of what the word fiduciary means. Now, an area where we all agree is a problem and have avenues to find common ground on a solution is lowering the cost of prescription drugs. We have to reduce the price Americans pay for medications. It is a priority. And we need good policy that considers all factors to come to the right solution. Dr. Marshall and I are doctors who have treated patients for over 25 years. Mine were uninsured. You've got to be conscious of the tension between affordability and innovation. People in this room are alive today who would not be alive were it not for medical innovation. And a component of this, that innovation is driven by profit. But we also have to recognize that if the patient cannot afford the drug, to them it is as if that innovation never occurred. As ranking member of the Health Committee and as a physician, it is a priority to not only protect Americans' financial health, but also to ensure the access and innovations that benefit their physical health. And this is an area where Democrats and Republicans can work together to benefit patients. The next 2 years of the 118th Congress has great potential for this committee. I look forward to the debate. I am pleased to be working with Senator Sanders, and hopefully we can together find those policy solutions that will be better for all Americans.
Senator Cassidy, thank you very much.